Well, it's going to be nice to have storage where something is kept dry and clean. We can monitor drugs better and leave them right at the building and know that they won't be rained on or soaked or people have to run and cover them. So that'll be very, very nice. But additionally, we want to create a space where people who are sputum positive can stay. And I realize that if you're from home and you go in and you find out you're sputum positive and you need TB treatment, you take your treatment and you just go back home. You just keep taking your treatment every day. But here, we have so many people that didn't live right in town that they're now staying with other people. So if someone has sputum positive TB and they're staying with someone who wasn't their family, during those first 2 weeks especially, they could be fairly infective. They say that one sputum positive person infects 10 to 14 people a year. Well, of course, I don't know how many people they will infect in those 2 weeks, but it's actually 4 weeks because they first had to come, then they had to get their pneumonia treatment, and then finally someone checks their sputum, and finally they get admitted. So 2 weeks after that, which is approximately the 4-week mark, they have had a good chance to infect someone that they're staying with. So as soon as someone's sputum positive and they're not staying in their own home, they're staying inside somebody else's mud hut, we would like to have them have a place where they could stay for the first 2 weeks so that we prevent a little bit of the transmission to other families. Having said that, lots of people live outside, which is actually much better. The wind and the sun are good to get rid of TB. But we don't want to be the people causing TB to become worse here in Old Fangak. We would like to try to protect the community if we could. So that will be good. There's also the group of people that have spinal TB. Spinal TB is, instead of having the TB in your lung, it's by the blood perhaps, or by the digestion, somehow into your spine. And when it went into your spine, it causes the front part of the spine to get eaten, and then pretty soon the spine has a break in it that sticks out, so your spine will stick out and back. But below that break, you can have neurologic problems. And some of those neurologic problems make you paralyzed. And some paralyzed people get wounds. And if you get wounds, it's nice to be not in the mud sleeping, but out in an elevated place where you can have your wounds washed. So we may have some ability to do that with a new building. So those are the most obvious things that we're going to do. It also is very nice to have a building for people. Everybody knows where to come then for their directly observed therapy. Everybody comes every day to swallow their tablets, and they will have a nice place to go sit down in the shade, wait to get called for their tablets, and drink the water that's in a well that the Alaska team built there. They can drink that water, and if they're sputum positive the first 2 weeks, they'll stay there. Otherwise, they'll play around, and then in the afternoon they go to their place where they're staying in the village.